Welcome back to the Stepping In podcast. This is a special series where we're going to be looking back on the important stuff, the people in your workforce. Over the next couple episodes, we will revisit how systems undercut workforce. It never ceases to amaze me how frequently workforce issues are really leadership or lack of planning issues. Sit back and let's reflect on what we have learned to design a better system to promote and maximize efficiency. So let's bring the best to the front and let's focus on the people that we have, not the people we wished we had. Well, here we are, Renee, in rainy Champaign, Illinois.
Yeah, we are on having another interesting week with all the rain. We had a lot in Iowa earlier this week, and it's moving across the country apparently, because here we are with a big thunderstorm going on up there.
I know some late season rains are great for the crops. And so as a farmer, I'm just ecstatic to see rain, no wind, no storms, just rain.
Just rain.
We don't need hail. We don't need anything else that could really knock off a really exceptional growing season across parts. But, across the country, there's been a lot of variation between still dry some places. There's been extreme weather and flooding in others. So, you just never know what's going to come your way.
Yeah, but Iowa is out of drought for the first time in like 5 years. So
I know.
a lot of rain. That's pretty crazy.
I know. Too much rain in some places, though. So, as a farmer, it's never enough rain. Otherwise, it's too much rain. It's never just right. So kind of like Goldilocks said, you just kind of have to always be.
Yeah, for me, though, this week it's a lot of thunderstorms, but there's no sirens. And so there's been several storms, and I'm like, wait, there should be sirens. We should be in the basement, and they're just thunderstorms. But I'm so accustomed to big wind, big storms, hail, all the things so you're right. I'm appreciating it being just rain.
So
tonight.
you realize all the sirens do for farmers is that's our guide to go to the front door and see what's going on, right? That's the purpose of the siren in small town, rural areas is that's just hey, come out here and take a video and look at what's happening, get out the door as far as you can and still not get wet or hit by the hail.
Yeah.
That's how farmers view tornado sirens.
It's to get away from the big windows because they might decide they're coming through. So
okay.
It's not that we don't want to be around and look at things, but we also don't want to be harmed. So
right.
So today's going to be a little bit different of an episode for us. We're actually at the Rural Health Conference in Illinois, and we're going to kind of walk through some of the topics that we're talking about at this conference. To share those with you, we'll have some things in show notes that you can look at and then get some more information for yourself about it. But it's going to be really more of like, these are the themes we're seeing across the country. We had done a few episodes back on some of the themes, but we thought since we're here today, we'll just show you exactly what we're talking about state after state after state and talk about each topic. So to kick us off, Jason, one of the things we're talking about is called Surviving the Perfect Storm, How Millennials Must Save Healthcare.
Yeah. Fun topic. I'm looking forward to hearing this one. As we think about, and this is something I've listened to so many keynotes at so many conferences this summer, from being next door in Indiana to jumping across over North and South Dakota. It's really looking at our future workforce, right? And how are we going to change and adapt to the changing needs of the millennials. And I think it's been a tough conversation that a lot of people don't want to hear and don't want to have at all.
Right. And I know they're very different. So one of the keys for people that may not know is millennials are all about working to live, but they don't want to live at work. And this is one of the things I think that they're actually on the better end of that. I know some of us in the Gen X and the boomers and the silent generation before, we just worked ourselves to death. And you can see that by the number of hours people put into the offices and just the lack of balance and lack of blend in their lives. And millennials are not about that. They want a job that makes a difference, but they also want to go home and they don't want to be on call all weekend, or if they're on call, to be paid for it. And I don't think any of that's unreasonable.
I think they're smarter. I know that they're way smarter than I was at that age. I had to get older before I realized that, I'm not going to do all those hours. I'm going to structure things differently. Before I was at a place where I could structure things differently. So I think millennials have a lot of good things going for them, especially when it comes to emotional well-being. They get it. They get it in a way that so many others still don't get it. And so, I'm not sure what has to happen to change the culture in some of those, very rigid structures and organizations that are really unwilling to adapt to some of the changes.
I know for me as a leader of an office now, there's a lot more listening to just all the general things going on in a person's life. And we should always know that that's going to impact. But if there's problems with children at home or sick parents or whatever, that would impact the employee. But I don't think we've ever really listened to people about that and talked to them. But if you do, one, their work experience is better and the retention rates are higher. You can see that in the data. But it's also just better for the work environment, but it can be exhausting.
Mhm.
And I was trained in that field, and
Right.
it can be exhausting for me to have to hear it day in, day out, all the
Right.
things. So it's always for me just a blend of how much do you listen and be empathetic and be able to do that, and then being focused on your job, because it's not
Right.
like my workload and my expectations go away. So it's a tough challenge, and I'm even trained in it. So I
Right.
can't imagine folks that are really uncomfortable talking feelings. It's got to be really hard for them.
Well, and then do your policy supporting the person? I know a few podcasts ago I talked about I was up doing flood relief work. And one person said she had to go from FEMA appointment to insurance appointment to other appointments, all from 8 to 5. And her workplace, she just started there. She didn't have time off. She didn't have paid time off, and she couldn't even get unpaid time off. So she could just take care of those bare minimums so she could have a place to live. And so we have to think about flexibility in a different way. And I know that that's really hard for some HR departments to do, but we have to think about maybe we need to let people let their PTO go into the red when there is a huge disaster and someone loses their home, right? And that's not things we generally are okay with. And that can be really hard policy wise to get comfortable with. But there are certainly exceptions and things that happen in these times that if we want to keep that employee longer term, we have to be willing to make some concessions. And it's not just a rigid black and white yes or no question, that there has to be a gray area, and we have to find ways to work through those gray areas.
And I know with me working in government, the flexibility is just not the way
Right.
it needs to be. I mean, the handbook still says it's 8 to 4:30, even though they have these telework policies and things, it's still the general work hours. And, there's not that flexibility for evening hours or weekend hours. And so, trying to build flexibility within a pretty rigid structure isn't very easy.
No.
And so
No.
we're working on that right now. In the month of August, we did a hybrid for a pilot project for people to work from home and to try to test it out and see what kind of policies should work or not. And we're going to be implementing and then reassessing what worked, what didn't, all of the things. And so this is a very interesting point. And if millennials are not in healthcare, we're not going to have the help that we need. And with an
Right.
aging population, especially in Iowa, more retirees, more people that are going to be over the age of 80, over the age of 100. We have to rely on those younger generations to help. So I'm really excited to see what they're going to talk about here. And the person that's the keynote, his name is Don Harkley. He's the CEO of People Centric Consulting.
Yeah.
I thought that's pretty cool, putting people.
It is cool.
And so I'm really excited to hear more about what that's about today.
I have to after that. What are you going to go to next, Renee?
I think I'm going to go to the one about accessing peer recovery in rural communities, because we
yeah.
love talking peer. And the last one we just finished, our last podcast, we were just talking about peer recovery and the being Recovery Month. I think it's the perfect topic for right now for Recovery Month, and thinking about peers and how just important they are in the entire system.
Yeah, this has been one that's been missing at a lot of conferences I've been at. And we've been the ones talking about peers in our breakout sessions, probably more in some conferences. I'm really excited to see that they have a separate breakout just to address peers here in Illinois, because I think that's part of the workforce that is a huge opportunity. The part of the workforce that's being left behind. In a lot of states, there's even certified peers. In Iowa, we have certification. So it's like a professionalized peers that are available to be utilized in a lot of different ways, from hospitals to treatment centers to prevention activities. And so I'm so excited that that's part of the conversation. And I think there's so much more we can do when it comes to supporting workforce, and filling some of those gaps could be totally done through using this population that is completely underutilized at this point.
Right. And so this one's coming out of Southern Illinois University, and it looks like it's for recovery peers.
Yep.
And so we have recovery peers also in Iowa. And one of the things that I found crazy in Iowa that I hope gets realigned in Iowa with the realigning of public health and HHS, it's a smaller thing, but recovery peers were kept very separate from mental health peers and family peers. They're all kind of disjointed. So I'm hoping now we can get them all under one roof and the similar type. So what do you think about next? Are you excited to learn more about? You got another one that you're thinking about?
Well, I'm thinking, there's a couple that kind of go more medical, right? Because we're talking about rural health, we look at healthcare. And so there's a session about comprehensive chronic care management. And, when we think about chronic care, we think about
co-occurring condition, multi-occurring conditions. We just don't think about behavioral health conditions. We have to think about the physical health conditions go along with them and how oftentimes those things happen together at the same time. And so I think the more we talk about chronic care, the more we talk about pain management, the more we really need to talk about depression, anxiety, substance use, and how are all of those things being treated together,
Right.
holistically at once, and not fragmented and siloed, because our systems are so oftentimes siloed and fragmented. And so I'm really anxious to see when we go to this chronic care management, they're focusing on Medicaid, Medicare, but really looking at how are these systems communicating? How are these systems and provider networks coming together to support the whole person? Or are we just looking at truly the medical condition,
Right.
and not taking into account the emotional toll that having a chronic condition takes on it?
Right. And what's interesting is the federal government is tying this now into detention and into incarceration, into especially at the juvenile level and people that are youth status coming out of those things.
Yep.
And so it's not just chronic conditions, but then thinking about like their life experiences,
Right.
and connecting it to wherever they are located and wherever they're housed.
Right.
And it's going to be a very large conversation and a very important one, because you can't separate those things. One of the other pieces of that we've talked about is medication donation. And I think I shared this. I've got a personal story here. My parents collected old medications. My dad would call them the backup meds.
Well, just in case.
Hundreds and hundreds and hundreds and hundreds of pills in bottles and bottles and bottles. And none of that was safe. If there was ever anybody break into the house, it would be a farm party right off the top. Just who knows who'd get ill and sick and die. And then the other side of the family, I had a different family member that stocked up on Xanax and had just hundreds and hundreds and hundreds of pills upon his passing. And we had to figure out how to destroy them in a safe manner that didn't harm the environment, and bring in hospice and others who could help with the medications. And it's a really big deal. But one of the programs I wanted to highlight, and we'll put it in our show notes today, is SafeNet RX. It's out of Grimes, Iowa, and it's doing amazing work for us in Iowa with repackaging those bubble packs of meds for persons that maybe their medications have changed or they've passed away from like nursing home settings. They get all of those bubble packs back and then can reissue them to people, especially in incarcerated statuses and places where it costs, you don't have the ability to fund them medications. And it's making such a big difference for ongoing care. And it's helping the bottom line, the budget, because instead of just wasting money and pitching those into, they're just getting them donated to them. And then because they're in those individual bubble packs, they haven't been touched, they're not damaged or compromised in any way. And so SafeNet RX is one. And I know there's others around the country that are doing the same. That's just the one I know. And those are just amazing programs. And they can talk about the billions of pills that they can repackage and not just pitch. And so thinking about like donating medications and being safe with it, there's a lot to think about.
Absolutely. And it says right here, in the book, $11 billion worth of medication goes unused. And think about how many people can struggle who can't even afford the medications. And, it's so frustrating sometimes. And so thinking about both those medications that are stockpiled in some places where people hold on to them, just in case they may need them again, and how dangerous it is, we know, to have prescriptions laying around the house when there's grandkids or others who could go in and take those meds just to try to get high. But then thinking also about how can we best dispose of those medications, if they're not bubble packed. There's a lot of, you take them back to your pharmacy, take them back and drop them in a safe locations where they're just destroyed. It's just so important to think about how do we manage all of those things, because, there's just so much risk involved all the way around.
Right. And I think I have some, in fact, I know I do some family stories where they got confused medications because their old ones were there and then they brought home their new agreement, but they didn't have some, but they thought were confused and maybe should take it. And there's side effects of that and illnesses and things that happen. And so, helping people, there's some awesome programs out there where nurses actually come into the home and help people remove all the stuff they don't need. Gosh, my family would 100% need that because they just keep stuff around and, for the just in case. But if you accidentally take too much of any given thing that now is contraindicated with something else, bad things happen. And so how about the next one? What are you interested in next?
Well, I'm really excited in the next one because I like all three of them. And so they all three are somewhat applicable. And so, again, we have some a rural health clinic talking about care coordination, and I think that has been something we've heard a lot about what is care coordination and what does it mean to coordinate care. And, as we do work in this space as well, where we're helping agencies to better understand what the definition of true care coordination is, how you really dig in and truly connect and coordinate. But I think that that's really good to think about, how do you measure it, right? So we're really looking at this from a quality improvement perspective of how do we manage that. The second one on this afternoon is healthcare security and workplace violence. I think that's something that's come up a lot in some of the conversations that we have, especially with hospitals, and especially when we think about telehealth and delivering that emergency room setting, that oftentimes people can appear volatile. Oftentimes it's not someone's best day, but oftentimes that can be escalated by the staff depending on kind of how they're doing that day.
So let's talk about the story in a hospital up north, to not be named.
We won't talk about that name, yeah.
But their plan on who they had respond in case of a volatile work
Right.
experience. Because we know, knowing what we know, that it just made it more volatile.
Right.
But there was an all call. Every single staff person available had to show up if there was a volatile person. So, but
It's a small hospital, so to be fair,
be probably 5 to 10.
Oh yeah, yeah.
Easy. And so if you're a person that's a little paranoid, you're a little upset about, you're scared maybe for your what's happening to you that day, the test you're taking, or whatever, and you're concerned and you're worked up, and then the person at the front desk now is worried about you, and then all these other people start showing up.
Right.
Is that gonna de-escalate that?
No, and oftentimes the other people is maintenance.
Right. Or in that place, remember the folks in uniform that were with the ambulance folks,
Right.
also there, that looked like they were dressed like police officers,
Right.
or security guards,
Right.
and it just escalates it further.
Right.
So when we talk about this conversation, and I really am excited to hear this one today, because I want to hear their thoughts, because it cannot possibly be what that hospital said, because we know that would have just increased the
And I think the challenge is to balance it with, there are real security threats, and we have to think about guns being brought into emergency rooms and clinics. We have to take all those things into consideration, but we also have to take into consideration someone who's having a psychotic break, who's not in touch with reality, and how do we de-escalate those folks and not criminalize mental health. And I think we're having a real struggle right now in these conversations across the country of how do we walk the fine line between creating safe, secure places, but also de-escalating individuals who need to be de-escalated. And that's been a difficult conversation, and it's a difficult conversation within law enforcement as well. I do de-escalation trainings, and there's some confusion right now about how do we do that? How do we promote both things at the same time? And that's a struggle for a lot of folks right now.
Reminded of the time we went and trained the library about this, because they were in this situation and they don't have the staff that can do the all call, but you might have somebody, and they were talking about their procedure was to have the person walk them away in a more private space to help them have privacy and calm down in private, and not to show a light on it. And they were having much success with
They were doing a great job.
They just needed an emergency button for somebody to come man the desk. If one person walked off, they needed who could come and do the rest of the work. That's a much better way than trying to light on it and then make it bigger.
And
it's interesting to see what this conversation's about, because there's ways to do this right, and then there's 100% ways to do it wrong, and we've seen both in some places, and it's pretty interesting.
And the last one this afternoon, like I said, I can't be in 3 places at the same time, is understanding and addressing the impact of stigma of substance abuse disorder in rural communities. And I think that we can never have enough conversation about stigma and the impacts that stigma is having on accessing care, on making access appropriate, available, so people feel like they can access, right? And so I think that's always a good conversation to have. And the more we can get our healthcare providers to be part of that conversation, the better.
Right. Yep. And then starting in the morning, there's going to be a federal rural health update with a keynote. And it's always good to hear what's going on at the federal level. And what I have found is most of these, if you are interested in knowing more about what's going on at the federal level, oftentimes coming to one of these local meetings, one of the state meetings, and you really get the picture of what's going on at the federal level. And they really are in line with each other. So it's really interesting to hear the federal update. And then I know we get into a topic that is one of those that's near and dear to your heart, is suicide, and how we're missing that diagnosis. That sounds like a fabulous training.
This does look like a great training, right? Of getting away from, well, I didn't know, right? Are we asking the question? Are we following up? Are we doing everything that we can do? And I think that's, there's some data here talking about how some of those screenings just aren't working out because we're not seeing the follow-up that needs to happen based on those screenings. So just because a hospital or a clinic says we're screening 100% of our people, on that PHQ-2, we're asking the questions every time. Well, what happens when you get a positive response how are you following up? What are the next steps? And that's where the data plummets. And I think as we see quality metrics, as we're getting improved quality metrics and we're looking a little more deeply at some of those things, I think that then we're going to have to answer some tough questions as to where is our core coordination efforts going? How is healthcare connecting to mental health, especially in those communities where those systems are still pretty siloed?
Right. And the same as in the incarcerated settings, I've seen screening tools used and then looking into the plan, and there may not even be any plan to actually address any of the issues. And you and I've talked about this. Is it better to screen and have no follow-up or to not screen at all? I feel like, coming from my background and my license, that I'm liable for what I screen and what I know. So it seems kind of crazy to me that a lot of places just really promote screen, which is only a small piece of that puzzle. It's like, what do you do next? And I think your data there talked about only 8% are compliant with like following up after the fact. 8%. So if you get 100% screened, but only 8% actually do something about it, we're really missing the boat.
I think I've soapboxed this before, that people say, we're going to do screening and it's great. And I'm like, no, it's not. Because until you can show me how you're going to transition someone from provider to provider, once you know that there's something going on that you can't treat, your screening is completely invalid. And so I'm really glad that that's a session here today.
Yeah, I am too. So I think that wraps up the sessions that we talked about today. But I know we didn't really talk about this before, but it's not going to be hard for you to answer. But when you think about coming to these, I value also the networking opportunities and the people that we meet. So are there any particular groups that you're excited to talk to, or people that you want to meet? I know you didn't get to come to this one last year. I did, and I met some really amazing people, and I'm excited to circle back and see them again and hopefully meet some other contacts, because there's other people that we kind of work alongside. I think of some of the architect conversations that we've had, that they could use some help with some strategy and planning before they build a new building, which we find all the time.
We do.
Get pulled in too late after the building's built.
We do.
It's not really working out. So you thought of anybody that you're kind of hoping that you meet this time around?
This is a tough question. I didn't know that was coming. I've had some great conversations with MCOs of different states. And so medical directors of MCOs are kind of getting their perspective on how they approach their work, of how they're managing things. And so, that's been some great conversations I've had in a couple states. I agree. The architects, I think architects are often kind of in the middle of trying to design, and sometimes providers not being sure of what it is that they're going to be delivering. And so really, and then not maybe thinking medical, taking into account, how do you co-locate mental health and substance use disorder? And so I think sometimes that's more challenging than it needs to be, because it's really bringing those systems together. So I think that's been a great conversation. I think of some of our telehealth partners that we often talk to. We kind of migrate toward telehealth folks, and there's a lot of telehealth providers at a lot of these folks. But we generally always are talking with Senior Life Solutions, ITP. They do a lot of great work, especially in rural areas. So we think about the geriatric population and what Senior Life Solutions does in rural critical access hospitals. We think about what ITP does in emergency rooms and jails, in order to have prescribers available to meet the needs of individuals across the country, especially in those rural areas who have difficulty accessing appropriate care. So, there's so many conversations we have when we come to these things.
Another one I really enjoy is when we meet some of the state workers that can validate or not validate the data. The data that we find for the states. We've had some great conversations about, specifically related to alcohol. There's been at least a couple that I recall last year that were my favorite, where we're like, the data doesn't look right on the state map. And then like, yeah, that's because we don't turn it in. And so it's really a way just to have.
That was Missouri, because Missouri is a very stark line when it comes to alcohol at the Iowa-Missouri border. Right. And we were like, we asked the
Utah looks like they don't drink it.
There was someone who wouldn't, they said, I work for Missouri Public Health, but I'm not going to tell you at what level. But it was pretty high. And they're like, yeah, we don't give the feds the real data. That's why it looks like this.
And last year at this conference, there was some data that I was looking at, and it didn't make sense to me based on what I knew in my work. And I went afterwards and got to clarify, and they were meaning it very differently. So it made more sense. But you're right, because you can pick and choose, as we always talk about, stats and things we want to talk about, and sometimes make things look better or worse, but to know what we're trying to do. So I've really enjoyed that. And I find all the speakers pretty approachable. And so sometimes afterwards, we can Can we use slides? Can we
Right.
have the slides? And so they're just really great
Well,
people because we're all working on that path to
yeah.
better rural health.
And I think that's what's sometimes missed is, if you're at an organization, sometimes leaders and supervisors and executives, they get stuck in the day to day.
Yeah.
And then you start to miss what's happening in the world around you. And I've always thrived going to conferences. When I was an executive, I would always go to national conferences because that's where you could see what was coming, right? Where you could learn about kind of maybe where your shortcomings were, what things you could do programmatically to do better at, and just to network with other people like yourself, right? To hear the same challenges, to learn about how maybe something you could take back and implement could make a huge difference. And I see so oftentimes people are like, I just don't have time, or there's all these reasons
Right.
people say to not go to conferences. And we're lucky because we get to go to conferences all over the country and learn and hear the themes and kind of pick and choose some different things. And it's really an education.
Right.
I learn more at these conferences than I would ever learn anywhere else. And I just find that so valuable.
Well, and it is what you make of it. I'm not the naturally extroverted person. So last year I was at this conference by myself, and they have a bingo card for like meeting all the vendors. And I don't normally do that because I don't need more tchotchkes or things at home. But I knew that if I didn't, I'd sit at a table the whole time by myself and not talk to people because that's my natural bent. So I was like, all right, I'll make it a challenge and I'll do that. And I met some of the coolest people doing it. And it wasn't necessarily that they needed to sell me anything. I didn't have to give them my email addresses and stuff like that. You can if you want to, but I didn't do all of that. But it really use it. And then you can use it and then make those follow-up calls afterwards. And we've had some great conversations since last year that came out of this conference. And so just challenging people, it's not enough just to go to conferences for that break. But if you really have a thought in mind of like, this is an issue I don't know an answer to, you can go find a solution or somebody else who has a story of something that might help. And I found them to be very valuable, but it's about my mindset. I have to decide that, hey, I want to invest in this and spend the time.
And we take solutions back all the time to the other groups that we're leading, right? The other collaborations, the things that we're doing, the work we're doing locally, we take these ideas back. And so I'm able to take the things I learned here at these different conferences back and say, hey, you know what? I heard what they're doing in Indiana. And if you know what? We can do something similar here. And they've already solved the problem. We don't have to go through this whole process. And I can call so-and-so. And we can get some information sent over to us, right?
I had a conversation with something going on with Medicaid and a bureau chief, and we were like, well, there's these 2 other states doing it differently, and they didn't know. And they're like, well, could you share that with us? Because we like to learn too, and we would like to be able to see how they're doing it because maybe we could. Well, maybe they haven't been able to get out to those conferences and have to do the day in, day out at the office. But it doesn't matter if you just do it as a time away and you don't really take that next step to implement and to network. But you can do so many things out of these conferences if you have that right mindset and if you really think about what you're trying to do. So I've really enjoyed it. So today, the self-care policy of the week is got to have a rain plan. I don't know if you can see it behind us if you're on YouTube today, but I like to do a lot of things outdoors. And recently I was teaching a water class and the app said it might rain, but it was like 50-60% chance of rain. So I go in to teach the class. Boy, did we get wet. And it was a lot of fun being wet until it started lightning. And then you can't be in a pool with lightning because that's a problem. But it was a lot of fun. And so it's like, do you want to be in the rain? Do you not want to be in the rain? I think we could a podcast in the rain, but we just didn't have all the things to have the equipment covered. And I was more concerned about equipment.
Yeah, I didn't really want my laptop to get poured on. I'll be honest with you.
Right. That wouldn't
well, that's, you're right.
Sorts of things.
Yes.
So we have to make rain plans. So for me, for self-care, you have to have a plan B sometimes. Your plan A may not work. I mean, you were down in the gym or looking at the little gym and you were like, I'm not going to run on that because there's nothing really for you to do.
It was facing a gray wall. There was no window. There was nothing. I'm like, yeah, I'm not going to go to the gym.
You may have to have a plan B in that because like the gym's not going to work out for us today. So that's my self-care tip is just like, gotta be flexible. And maybe the plan you were wanting to do, the one thing you were going to do for exercise or self-care or whatever gets rained out. So then make sure you have that other plan. And it turns out just as well. You just have to be flexible and think about it and not let that ruin your action.
And remember, you have to practice flexibility. We've talked about this a lot over the course of the years that when you're when you're in a high stress occupation or you're under a lot of stress yourself, what's the first thing that you forget how to do? It's be flexible. You get really rigid, you get stuck in what you're doing. And so, I haven't said this one for a long time, but my GPS rule that every time I travel somewhere, I look at my GPS and it usually gives me 3 routes. And a lot of times people are like, I'm just going to pick that fastest route
Yep.
to go. And what do? Because I practice flexibility,
Yeah.
is a lot of times I'll pick the one that is the longest, or I'll pick the one that I normally wouldn't pick, just so I get to see something different.
This ties us into one more story. Talk about the trip to get here and how long it took us just to get to Champaign. We did at least a couple roundabouts for various reasons.
Well, there was one exit we took that there was no sign. The exit ramp was open and I got gas and I went to get back on the interstate. The ramp to get back on the interstate was closed.
Yeah.
And I
didn't on GPS.
didn't know that at all. So we got to take a side route that was really nice. We got to see some things we never would have seen. We were flexible, right? And so that just pretty much highlights the importance of living flexibility every day.
Talk about that. Part of our self-care plan is taking the off-road, maybe seeing the thing.
Right.
It is a little more challenging to find things on the roadsides in Illinois. It hasn't been as many options of weird things to stop and see, but we did take a side route. And so, we do practice what we preach. Well, today, everybody, we just wanted to walk through what was going on with Illinois and their Rural Health Association and tell you that it's just like all of us around the Midwest and everywhere rural. We're talking about the same topics and the same information. We'll post in the show notes any links to any of their information today. So if you wanted to learn from them, we're going to have some amazing speakers and we're really excited to get to meet them and to network with them. So until next time, we'll see you again.